Hello, I'm Dr. Shaival Chandalia. I'm a consultant endocrinologist at Jaslok Hospital. Today we'll be talking about diabetes. There are two types of diabetes, type 1 and type 2. Type 2 is more common. In fact, 98% of diabetics in our country are type 2 diabetics. Um, Type 2 diabetes is genetically or it is in an inherited problem, but it then gets exposed or triggered by improper diet and exercise. So, diet and exercise can actually prevent type 2 diabetes. And this is an important point because although the genes or the inheritance is not in our favor, for example, if your parents have diabetes, but at least what you can modify is your diet and exercise. They have done a study where by diet and exercise, the risk of progression of diabetes from borderline to frank diabetes is reduced almost by 50%. So if you diet and exercise, you can at least delay the onset of diabetes or prevent it by almost 50%. In addition to this, diet and exercise is very important in treating type 2 diabetes. So it helps in prevention, but it also helps in treating. By diet and exercise, you can reduce your blood sugars if you're a diabetic. In addition, when you take medications, that also helps. So it's a combination of diet, exercise, and medications which is used to treat type 2 diabetes. So we talked about prevention and we're also talking about treatment. Now, often the question arises that is diabetes reversible? Type 2 diabetes in the initial stages, especially if somebody is overweight, can be reversed, or you can go into what is called as remission if you lose weight. So again, the role of diet and exercise comes in here, that with diet and exercise, if you reduce your weight, there is a good chance that if you, in the initial years of diabetes, that you can come off your medication. But remember, you need to continue with diet and exercise, and you need to continue your weight the weight reduction needs to continue for this remission to continue. So if you again gain back the weight and you don't do your diet and exercise, then it's likely that the diabetes will come back and you'll have to again start on medication. Having said that, in the long run, maybe after 5 years, 10 years, again, it's possible that even if your weight is reduced, you still will have to start with medication. So what I'm trying to say is that in the initial stages, you can go into remission, diabetes remission, by diet and exercise and weight loss. We are not sure how long that will continue, but you'll obviously reap the benefits of having a controlled sugar without medication for a period of time, maybe for 5 years, 6 years, or even longer. So this is called as remission of diabetes. And as I explained to you, the common thread between all these three, whether it is prevention, treatment, or remission of diabetes, is diet and exercise, which you should do in case you're a borderline diabetic or even you're a diabetic. And all this shows the importance of your nutrition, shows the importance of exercise in the long run. So with that, I'll end with my small take on diabetes and what is called as borderline or pre-diabetes. Thank you.